to the XYZ Company Benefits 2010 Open Enrollment Information Meeting podcast. This podcast is designed to give you an overview of the XYZ Company Benefit plans for 2010. Today we'll concentrate on changes that are taking place to your plans for 2010, including a review of the medical plans, the dental plans, and the flexible spending accounts. We'll also spend a time looking at some of the other benefits available to you, as well as a review of how to enroll in your benefits for 2010. Here's a detailed agenda of what we plan to cover today. In general, your XYZ benefits offering is much the same as it was in 2009. There are, however, a couple of changes we want to discuss. This year, XYZ will offer a $10 per month credit towards your employee contributions if you and your covered spouse, if applicable, complete a personal health assessment. The Personal Health Assessment is a confidential online tool that asks you questions about your health, family background, and daily routines. It provides a confidential profile that can put you on a path to feeling better and living longer. For employees, the PHA vendor will arrange for nurses to come to our work locations to meet with you, discuss your health, and conduct a confidential health screening. Completing the PHA is completely voluntary. If you or your spouse chooses not to complete the assessment, you will still have the same health care coverage, but you will not receive the $10 per month credit towards your contributions. In order to receive the credit beginning January 1, 2010, you and your covered spouse must complete the PHA by December 1, 2009. Medical costs are continuing to rise, as they have in the past several years. It's important that you do the math before you enroll. Since healthcare costs continue to rise, that means the amount you and XYZ pay for coverage may increase in 2010, depending on the elections you make this open enrollment. If you remain in your current healthcare plans and continue to cover the same number of dependents, your biweekly premium contribution will increase. How much your contribution increases in this situation depends on the plan in which you are currently and remain enrolled. If, however, you take the annual open enrollment opportunity to review your options and select a different plan, for example, you switch from the Base Plus PPO plan to the Base PPO plan, your contribution will actually be reduced even after accounting for the overall annual contribution increase. Let's take a look at some of the highlights of the 2010 benefits. For 2010, you can choose medical coverage under one of two Preferred Provider Organization PPO options, the Base Plan and the Plus Plan. Or you may choose the Health Maintenance HMO plan. The basic differences between the two PPO plans are the level of coinsurance and the amount of deductibles and out-of-pocket maximums. And the contributions are higher for the Plus plan, of course. In the HMO, though, you must receive all of your care and services through the HMO's network providers. When you elect a medical plan option, you also receive prescription drug coverage. Under the Base Plus plan option, XYZ covers more of the cost for the prescriptions than in the Base PPO plan. You will generally pay a lower percentage of the actual cost of your prescriptions, and there will be minimums and maximums to help you budget. A mail order option exists with both plans and can help you spend less on your maintenance medications. To use the mail order program, your doctor needs to prescribe a 90-day supply of your medication. Coverage under the HMO is similar to the Base Plus plan option. There is no change to the dental benefits coverage for 2010. Flexible spending accounts, or FSAs, are tax-advantaged accounts that allow you to set aside a portion of your pay for yearly expenses. The money that is deducted from your paycheck for an FSA is not subject to payroll or Social Security taxes, which results in more spendable income in your take-home pay. There are two types of accounts, a healthcare and a dependent care account. If you want to set aside money for 2010 expenses in the healthcare FSA, the dependent care FSA, or both, you must sign up during open enrollment. The healthcare spending account lets you set aside before tax money for your out-of-pocket medical, dental, and vision expenses. The maximum amount that you can put into the healthcare spending account will continue to be $4,000. The full amount of the account is available anytime during the year. The dependent care spending account allows you to use before-tax money to pay for your out-of-pocket child and adult-dependent daycare expenses. The maximum amount that you can put into the dependent care spending account is $5,000, or $2,500 if you are married and file separate tax returns. Reimbursement is available only up to the amount in your account at that time. You can continue to claim reimbursement as additional funds are added to the account throughout the year. For most people, the tax savings is roughly 25%, representing federal income and Social Security taxes combined. In addition to the medical, dental, and FSA plans, XYZ may offer other benefits to you as well. The company pays the full cost of basic life insurance for you in the amount of 2 times your base annual salary. You may purchase supplemental life insurance for yourself up to 5 times your base annual salary. You may purchase supplemental life insurance for your spouse from $10,000 to $250,000, up to a maximum of 100% of your basic and supplemental coverage combined. You may also purchase supplemental coverage for your children in the amount of $10,000. Evidence of insurability may be required. Short-term disability, sickness, and accident insurance provide income replacement when you were unable to work due to a non-work-related illness or injury. Vacation time is available to you based on your length of service. Other paid time off for various circumstances such as holidays, jury duty, and funeral leave is also available. Employee assistance is available to all employees through our vendor. It is generally used for grief counseling, marriage counseling, stress management, alcohol or drug dependency counseling, and other problems. Tuition reimbursement and educational assistance are also available. You can get more details about these benefit programs from your Human Resources Department. XYZ shares the cost of your benefits with you. Your contributions, which are shown on the AdvantageExpress.com enrollment website, will be deducted from your pay generally on a pre-tax basis. The amount of your contribution is generally based on 2 factors: the plans in which you enroll and the number of eligible family members for whom you elect coverage. XYZ will continue to pay more than 80% on average of the healthcare coverage costs of its employees and their families. Employees, meanwhile, will pay 17% of the cost of medical, dental, and vision coverage for themselves and their families. Employees who work more than 20 hours a week receive a prorated company contribution. Open enrollment is coming soon. It begins November 2nd and lasts until November 13th. Between now and then, you should read your enrollment guide carefully and consider your individual benefit needs. Carefully consider your own needs plus the needs of each of your eligible dependents. Become informed about what benefits are available to your spouse from his or her employer and decide which coverage is right for you during the open enrollment period. Between November 2nd and November 13th, don't forget to enroll online using AdvantageExpress.com. In late December, you will receive your new medical card from the carriers. On January 1, 2010, the new plan design and employee contributions will take effect. After you decide which benefits and coverage levels are right for you, you must actively enroll for medical and dental coverage for 2010 by logging on to AdvantageExpress.com. If you do not enroll by the November 13th deadline, your 2009 benefits elections, including those for your dependents, will continue through 2010. There is, however, one exception. If you wish to participate in a flexible spending account for 2010, you must actively re-enroll. Thank you for reviewing this presentation. For more information, please contact your local HR department.